All right, folks, welcome again to another Insight of the Week. And today I want to return to our little segment that I like to call What to Expect When You're Expecting to Have Surgery. And so last time we did knee replacements. I think that's a really great one. That's one that we see a lot of. So we're going to go into another one that I see a lot of, and that is rotator cuff surgeries, okay? So a lot of people out there walking around, maybe they have some pain in their shoulders and they go to the doctor and the doctor says they're recommending surgery to repair the rotator cuff, okay? It's scary and you don't know what to expect, so that's what we're here to help you out with. So first thing I'm going to talk about is what happens immediately after surgery, and that is simply put, they're going to take you out of surgery and they're going to put you immediately into a sling, and that sling is going to be just off your body. There's going to be a pillow there usually, and you're going to be kind of in this position, okay? Depending on the actual surgery, whether they just repair the rotator cuff or whether they repair the rotator cuff with the biceps tendon, which is a very common extra procedure that they do, you may not be allowed to move your arm pretty much from this position, okay? So that's why they're going to have you in that sling, okay? Sometimes there's something like a ball on the end of the sling for you to grip. We do recommend doing that because that's going to be a whole part of that same thing with a lot of other surgeries in the lower extremity, getting blood flow back up the arm, because you're not going to be able to move your arm. And that goes into number 2, which is precautions, okay? So when it comes to precautions after rotator cuff surgery, phase 1 after rotator cuff means no active movement, okay? This gets people very confused, okay? So let's get into that a little bit. Once you have come out of surgery, usually at least for 4 weeks, but sometimes as long as 8 weeks, you are not to move your arm away from your body in any way, shape, or form. You're going to be keeping it in that sling. That's going to be one of those things that can be very difficult to do because it is your natural occurrence to try and move your arm. So you're going to have to resist that urge, okay? We don't want to actively fire that muscle that's just been repaired, that tendon that's just been repaired. That's not what we're looking to do. We're looking to let that heal for a few weeks. In the sling, the other thing that they don't want you to do is bring your arm behind you, and that's going to mean something for sleeping, because sleep-wise, you're not going to want to lie on your back, and you're probably going to be sleeping in the sling. So when you're sleeping, usually a recliner chair or a chair is going to be where you're going to be sleeping for a few weeks. Be aware of that. That's going to be something you're going to want to prepare ahead of time. And speaking of preparing things ahead of time, yes, yet again, you're going to want to schedule your physical therapy ahead of time. So if you know you're going to be having surgery, make sure you get in and make that call to your physical therapist's office. Would love to see you and help get you going. In terms of the exercises that you will be allowed to do in the first part of the physical therapy, is going to be something called passive range of motion. That means that you'll be allowed to move your arm in certain ways, but not under its own strength, but using your other arm to do it. I'm not going to give you the exact exercises because it could, depending on which surgery you get, that's going to depend on which planes and which movements you're allowed to do. However, do know that it'll be something called passive range of motion, which means that it'll be exercises whereby your other arm is doing the work, okay? This arm is going to be mostly just hanging there. The one exercise that oftentimes they will have you do is something called a pendulum exercise, whereby you allow that arm to dangle and move your body, and this is something that a lot of people get wrong, move your body to get the arm moving and not actively moving the arm from this position. You're moving your body, and that allows the arm to kind of swing a little bit. Well, the doctors will get into that, and the physical therapist will get into that when you get out of surgery, okay? In terms of expectations, yes, there should be some expectation, as with any surgery, for some pain, okay? One of the things that they're probably going to give you is some ice, an ice machine to help ice the shoulder. It's going to be your friend to keep the swelling down. Usually, in terms of surgical incisions, there's only a couple surgical incisions, very small ones. They do these arthroscopically now. So a couple small incisions, about a centimeter or so in length. You will be keeping an eye on those. We will be keeping an eye on those for signs of infection, which are very simple. You've heard these before: redness, any pus, any stuff coming out a little bit of blood is somewhat normal, at least at the very first part of things, but eventually that should be gone and you shouldn't have anything coming out of there. Anything that smells bad, not a good sign, okay? Those are your expectations, at least immediately after you're going to be having surgery. Eventually, yes, you will be allowed to move your arm, and then eventually, even after that, start lifting weights. That comes later. Those are the second two phases. First, moving the arm actively, and the third phase, starting to lift the arm. Those will be coming later. So that's what to expect when you may be expecting to have rotator cuff surgery. And again, make sure you schedule with your physical therapist as soon as you're ready so that we can get you in and get you moving. That's our Insight of the Week.